One of the real benefits of getting together annually is the opportunity for AFTO members to share solutions to common concerns. The How To Award is based on sharing new ideas for achieving goals. Interprofessional primary care teams throughout the province continue to find ways to make their practices more effective and efficient, whether through collaborations with other agencies or obtaining grants to allow their ideas to spread. Today, we celebrate some of those achievements. Creating a partnership with the City of Greater Sudbury allowed City of Lakes Fit to consult with numerous local leaders about ways to create a healthier community. Consultations led to a report on population health and a conference that mobilized more than 150 community leaders around a new approach to population health. This has now become one of the city's priorities. Temagami Fit's clinic was a successful pilot site for pulmonary rehabilitation and aims to become a Northeast pulmonary rehab referral site. Once it's established, the team hopes to expand the program to other community-based centers in the district. Patients living with chronic disease can take part in Alliston Fit's Nordic walking program. It's also open to the community at large. The team's RN and respiratory therapist started the program to engage patients who are uncertain about their abilities to complete an exercise program, while providing a low-cost alternative to a gym membership. By partnering with more than a dozen agencies, one small team in Harrow can expand its reach and offer education and programming for its patients and community members. They offer space and provide promotion for programs and services open to the public. The Be Well Community Collective partnered to develop tools and resources that improve the health and wellness of area children and their families. The collective used a structured approach, including a needs assessment, search for validated tools, a website, and screening by physicians. Georgina NPLC became a model of resilience after a fire devastated its premises this January. The 3,000 patients it serves were panicked by the loss of services, so the key was to resume operation as quickly as possible. Within 39 hours, the nurse practitioner-led clinic resumed seeing patients at temporary locations. Data collected by St. Joseph's Urban Fit showed that patients had a real problem finding the correct clinic location because there are two. They mounted a 4-month campaign to ensure that patients visited the right clinic. Their efforts reduced stress for patients by cutting the number of missed and shortened appointments by 13%. It also saved the time and money required for rescheduling. Dr. Bernie Murphy, a Couchiching team physician, led an initiative to add reminders about renally sensitive medications to the EMR, benefiting all patients with renal impairments. Physicians have access to these reminders as they prescribe or change medications. Their availability can prevent the cost of unnecessary or inappropriate prescriptions. Mount Sinai Academic Fit created HIPS, home-based interdisciplinary primary care for seniors. This collaborative approach delivers care to isolated homebound seniors with medically complex problems. By creating a team-based data standardization committee, North York Family Health Team has promoted process consistency to enhance the quality of patient care. The team, which includes physicians, IT and QI personnel, and IHPs, has incorporated evidence-based EMR tools and facilitated their successful uptake. The result is better patient safety and improved care. By implementing an intensive interprofessional program, Loyalist and Northumberland Fits reduced cardiometabolic risk for their patients. The two teams identified patients with metabolic syndrome, put them on individual diet and exercise programs, and supported them in making behavior changes. South Lake Academic Fit created a complex patient program with a broad team-based approach applicable to various age groups and medical conditions. Using a unique care plan for each of the identified patients, the team has provided a level of care that would not be available to patients otherwise. A hospital discharge follow-up process has smoothed the transition from hospital to home for Tilbury District Fit's patients, leading to a 12% decrease in 30-day readmissions. The patient-centered approach uses an interdisciplinary team's strengths and assists patients in navigating the healthcare system once they're home. A QI committee with patient representatives partnered with the team to develop this approach. Credit Valley Family Health Team introduced an initiative to reduce long-term proton pump inhibitor prescriptions for which there was no valid indication. This effort helped decrease risk of such problems as fractures and B12 deficiencies. Results show that reassessing PPI therapy annually has increased the percentage of patients who have deprescribed from 4 to 30%.
Valsartan, you were recalled. Valsartan, switching the ARBs.
In addition to its PPI program, the team responded quickly and thoroughly to the national Valsartan recall. The pharmacist/student identified all affected patients and devised recall strategies. The coordinated approach involving patients, prescribers, and pharmacists allowed for seamless transition to alternatives. GuelFit has been named a Best Practice Spotlight Organization pre-designate. This period allows the team to use resources and supports to identify opportunities to enhance care through evidence. A 3-year partnership with the Registered Nurses Association of Ontario will enhance evidence-based practice and policy development. Each of these teams has taken up the challenge of improving its processes, services, or educational opportunities. They're all worthy of our praise, but none more so than our winner, whose work focuses on the frail, isolated elderly. Our panel was truly impressed by the collaborations evinced by this team's initiative, both intersectoral and in-house. In addition to the healthcare services it provides for the growing senior population, the program includes additional valuable services, such as friendly visiting, pharmacy, and intensive case management. Our panel viewed the program as both expandable and scalable. Indeed, referrals are accepted from within and outside the team, and the program continues to grow. We applaud the fine work being done by Mount Sinai Academic Family Health Team in providing home-based interdisciplinary primary care for seniors.